Welcome. This is Talking Europe, and I'm Catherine Nicholson. Thank you very much for being with us. Now, for our very first programme back after the summer break, I'm very pleased to be speaking to somebody who has arguably, along with his colleagues, made one of the biggest contributions to human health in recent history. Professor Andrew Pollard leads the Oxford Vaccine Group. They're the scientists who developed the vaccine against COVID-19, which is produced by AstraZeneca. Now, it's a jab that has given protection against COVID-19 to hundreds of millions of people worldwide, though its story has not been without incident, including, you might remember, some negative comments from France's President Macron back in January, some concerns about its safety, and outright manufactured information, fake news. Professor Pollard was named in the British Queen's 2021 honours and is now a Sir. So I'm very pleased to say, Professor Sir Andrew Pollard, thank you very much for being with us today on Talking Europe.
Good morning.
Thanks for being with us. Well, let's get straight in. This time a year ago, there were 0 vaccines against COVID-19. We were all wondering, will there ever be one at all? Now, yours is one of several that have been approved in various countries. How do you feel about this contribution that you and your team have made?
Well, I think it's just fantastic to be in the position we are now. And as you say, a year ago, many people really thought that it was going to take several more years before we would have any vaccines. And yet globally now we have over 5 billion doses of vaccines distributed, 1.2 billion of the vaccine that we've been involved in developing, and many hundreds of thousands of lives being saved at this moment by vaccine programs all around the world. So it's fantastic. And it's not just the staff and the developers, it's the incredible trial volunteers who took part in these studies that allowed us all to be in this position where we're protected today.
So many people involved, as you say. Well, right now, as I mentioned at the start, it's sort of back to school time here in France and around Europe, at least. Children and students, a big proportion of them going back to schools and colleges, unvaccinated, either because they haven't had access to vaccines or they're not actually eligible. Here in France, vaccinating 12 pluses, as well as in the UK, Germany and some other countries. Is this a useful measure to vaccinate children aged 12 plus?
Well, younger children are at relatively low risk from COVID. So the overall benefit of vaccinating children is small. But there are some subgroups who have a slightly higher risk than healthy children. And many countries are considering vaccinating those in the teenage years, and as is already happening here in the UK. And once that group has been vaccinated, for other children, healthy children, the overall benefits to the child are very, very low because just the risk of COVID is so low in children. So I think it does bring some confidence to people when their children are vaccinated, but the actual benefit is relatively small.
Another issue that's on many people's minds at the moment is how long does the protection from your vaccine, from the other vaccines, last? I know in the UK, people started being vaccinated at the very end of December, a little bit later around the EU. A recent study found that protection does start to wane within 6 months. For the vaccine developed by your team, effectiveness fell from to around 76% after 4 to 5 months. How worried should vaccinated people be?
Well, most of these studies focus on mild infection. And the reality is that with the Delta variant and with future variants, the virus is adapting to be able to infect individuals who have already been vaccinated. And I don't think we should be so concerned about those metrics because that is actually how we live with viruses normally. We have enough immunity to protect us from severe disease. And we we meet the virus and we get mild infections with them, get a cold with them. So that in itself is not so worrying. I think the key thing is to be watching the data about the more severe disease. And so far, all of the reports have suggested that protection has been holding up against severe disease with the vaccines. And even if it were to start to wane, is the way the immune system works is that immunity doesn't suddenly fall off a cliff. And so it will be possible for scientists to pick that up and to advise the right moment that boosting is needed, if indeed it is, and or if there are particular subgroups of people who are perhaps at more risk than others. But there's no reason to be alarmed at this moment about any waning effectiveness.
Oh, well, you mentioned there the idea of booster vaccines. Great discussion about that in many countries at the moment. Should we be looking to, blanket, give out booster shots this winter to people who've already had their 2 doses, would you say?
Well, I don't think the evidence is there at the moment to suggest that we need to do that. And clearly, if boosters were required, then they would need to be made available. But there isn't any evidence that wide-scale boosting is going to be needed at this moment in time. And of course, that would be giving a third dose to people who've already had 2 doses and have very high levels of protection against severe disease already, whilst people are dying in other countries because they've had 0 doses because of no access to them. About 10,000 people will die today because they didn't have access to a vaccine. And at this moment in history, with 5 billion doses out there, that actually was enough to prevent most of the deaths that would occur in the second half of this year. But so far, we focused on giving the doses we do have to people at relatively low risk in richer countries and children, rather than focusing the doses where they can have the biggest impact, which is in older adults and people with other health conditions all over the world.
Well, looking at that idea of the global nature of this pandemic, of course, yes, at this point, there are many countries around the world that have vaccinated very few people. If we just look at the continent of Africa, the average rate of vaccination across African countries is below 8% at this point. Do you personally see rich countries like the EU's members, like the UK, as being guilty of vaccine hoarding, of being selfish?
Well, I think it's actually a failure of the international community to come together. I mean, there are processes in place to try to drive vaccine equity through COVAX, which does have a very clear plan from the World Health Organization about how to make sure that we do prevent most of the deaths in the world. But what's happened is really driven by domestic politics, is the focus on those countries which have the greatest access and having very high coverage in locally, rather than looking at this global program that's really needed. And of course, it's important to save lives, so there's a moral requirement, but it also defends our own health security if we suppress the virus in other countries. It defends our economy if other countries are able to get back to normal because people are not dying there. And so there's good self-interest as well as the moral need to share vaccines more widely.
So would you say that by not having more equitable share of vaccines around the world, these wealthier governments are actually delaying the end of the pandemic?
Well, I think the end of the pandemic is very difficult to predict, but absolutely it only ends when the whole world has got control of the severe disease that puts the burden on health systems. At this moment, we've got the third global wave of disease, which is particularly occurring across Asia and indeed in North America at the moment, with very large increases in cases. And you mentioned Africa, which has also seen big increases of cases over the last couple of months. So I think we've got in Europe a sense that things are improving because of the very high vaccine coverage, but really from a global perspective, we've got a long way to go.
Just a word about vaccine hesitancy and vaccine skepticism and outright fake news. I know that you yourself have been the target of some vitriol from anti-vaxxers and people who don't want to take the vaccine. Here in France, there's a sizable minority of people still opposed to vaccination to various degrees. What would you say to somebody who is still not currently convinced about the merits of a vaccine?
Well, where we are at this moment, the virus is here in our communities. And people are unvaccinated, as we hear in the news almost every day, are at high risk of getting infected. And some of those, sadly, will develop severe disease, end up in hospital, or even die. And I think it's really important that as scientists and as the public health authorities continue to provide all of the information that people need to make good decisions around their own health, around vaccination. In the end, the threat here is the virus. It's not from the vaccines or from the public health or governments. We're all, I think, here to try to defend human health and to improve the situation that we have here in the pandemic.
Now, there are obviously other viruses, other illnesses out there other than COVID-19, although that's the only one we ever talk about. I know that you and your group are currently working on vaccine trials against plague. Now, probably for most of our viewers listening to this, here in Europe at least, it's a disease they associate with the Middle Ages. No one would ever expect to catch it. Why develop a vaccine against this specific illness?
Well, I think that first of all, just to say a little bit about plague, and although clearly at the moment in Europe we have a very good public health system, which means that we are not at risk of large outbreaks of plague, but historically we were. And it's a rather chilling reminder of, in some ways, how lucky we've been in this pandemic with a mortality from coronavirus of under 1%. Plague wiped out about half of the population of Europe, and it took 100 years for the population to regain its numbers after the Black Death of the Middle Ages. And today, plague does still cause outbreaks in parts of Africa, particularly in Madagascar in recent years, but also there are cases reported in many other parts of the world, in Russia and in North America. So we do still have the bacterium that causes plague out there. And that does put populations at risk. And so we need to continue to develop vaccines that will protect people against other diseases. It's not just coronavirus that's a problem in the world.
Indeed. Well, that's all we've got time for at this point. But thank you very much for speaking to us, Professor Andrew Pollard.
Thank you.
Thanks to you for watching as well. And I hope you stay with us. We've got more European news coming up for you in part 2 of the programme.